Welcome, everyone. I'm Dr. Aletha Maybank, Chief Health Equity Officer at the American Medical Association, and I'm honored to serve as the host of the All In for Kids Healthcare Summit. We are just asking for 15 minutes of your time today to talk about what we can do as the healthcare community to address the crisis of childhood adversity and trauma. And that's the spirit of today. Everyone, take steps that will help kids and families in your life heal from trauma and adversity. We want to share with you 5 things you can hold in your hand and your heart. 5 everyday steps you can take to protect kids and families from trauma and help them heal. Let's hear first from one of my favorite doctors in the country, California's Surgeon General, Dr. Burke Harris, revisiting a discussion that she had with Angelina Jolie at the onset of the pandemic.
What happens to a child, if you can explain, when they carry that trauma and it's not addressed, when it's not treated?
Well, that has been the focus of my research and my clinical practice for many years. But what we understand is that especially repeated exposure or severe exposure to adversity, when it's not identified, when it's not intervened upon, can actually lead to long-term changes to the children's brains and bodies. That the biological stress response can become overactive. And that overactivity, which means that the body experiences higher levels or prolonged levels of stress hormones like adrenaline and cortisol, that can lead to long-term changes in children's brains and bodies. The thing that literally gets me out of bed in the morning is the recognition that we have the power to change that, right? We have the power to raise the awareness, even through this conversation, right? And I think that we're in this moment right now where we have just a powerful ability to, or opportunity, I will say, opportunity. It's a window, and I hope that we take advantage of it to really change this narrative and raise awareness so that we are doing things differently across the board.
What have you been able to do? I know you were working with Governor Newsom, and I know you've been pushing for many things. What have you been able to make some progress in the last 10 months with some of this, or are there certain things on the horizon that we should know about that you're fighting for?
So I just finished the California Surgeon General's report on adverse childhood experiences on toxic stress. And the whole focus of that report is starting with the science, so folks know that this is a public health crisis, and then going from there and saying, okay, so how do we respond in healthcare? And that's why we in California have launched this initiative called ACEs Aware to train all of our healthcare providers on how to screen for childhood adversity, for adverse childhood experiences, and how to recognize signs and symptoms that an individual may be having what we call the toxic stress response. And what that means is that we are, getting to that point, starting to move the needle where at least among our healthcare providers, right? This is really becoming common knowledge. Folks are understanding. And here's what's nuts. Of our almost 15,000 healthcare providers who we trained, 97% said they plan to implement this work in their clinical practice.
I'm Quita Highsmith, Vice President and Chief Diversity Officer at Genentech. We recently completed a study among adults that revealed a crisis of trust in our healthcare system among those who need it most. How do you, as a pediatrician, recommend we engage with kids and their parents in ways that allow them to trust you?
Trust is critical to establishing a therapeutic relationship with children and parents. As a pediatrician and advocate, I treat every single child as if that is my child. And the decisions that I make for my patients are the same decisions that I would want to have made if my child was in the pediatrician's office. The ways that we establish trust with families are very much about showing up, and that we show up authentically, that we create safe spaces, and that we're willing to have hard conversations with families.
We're honored to be part of the ACEs Aware initiative, where we're providing training and technical assistance to healthcare providers like yourselves. As part of our work, we support providers' use of universal education about healthy relationships, positive parenting, and resilience before the screening to build trust in preparation for the screening. We also offer tools to foster ongoing relationships with community organizations that can offer support. These tools and resources are available on the All In for Kids website.
I want to ask you about racial justice and how that's so central to addressing trauma.
Racial injustice is inherently traumatic, right? And trauma-informed systems, trauma-informed practices are fundamental to healing our longstanding legacy of racial trauma in the United States. When we look at the ways in which experiences of trauma get under our skin and change our biology, and the ways in which that can also be handed down from generation to generation. And when I say handed down from generation to generation, I also mean biologically, the risk, like it can literally get under our skin and affect our DNA. We have to recognize that racial justice is a powerful issue of social justice, but it's also a powerful issue of health and well-being.
For me as a Black mother, a wife, and a daughter, I worry about my children every day. And so what do you say to families and kids who are confronted on a daily basis by these underlying threats to our health and our well-being?
I too am the mother of 3 Black children, and I worry every time they leave my house. What we do know is that racism is a public health crisis. We know that racism is a core determinant of health, that racism can affect our physical health as well as our mental health, that racism is linked to birth outcome differences, and that the science behind racism shows that it has a biologic impact on a cellular level. We have to teach our children that their race is beautiful, that their ethnicity matters, that they are exceptional, and that racism is the problem, not race.
This is a crisis that's not new. Black, Indigenous, people of color, families from low-income communities have been disproportionately affected by childhood and intergenerational trauma for centuries. COVID-19 has only served to exacerbate this crisis and implores us all to take action now. So let's hear from our colleague, Edwin Lindo, absolutely brilliant, who spoke about raising an Afro-Latina daughter in this country at the AMA's June webinar on police brutality, racism, and COVID-19.
I've been wrestling with how does my young Afro-Latina daughter maneuver this space. And I'll share a story that I've shared with some already. But I want you to feel how real this is for a lot of folks. I was riding her to daycare in the bicycle, and before I put her in the back of the seat, she heard the police sirens that were driving by. And she looked at me a little scared and she said, "Papi, are they coming for you?" And that's what we have to live with on a regular basis. And I have to explain to my 3-year-old daughter that no, they're not coming for me. But she's already been trained by the society that someone that looks like me is a constant target and fear of walking into the street. So it is an articulated feeling, but more so of just trying to figure out how we thrive and survive during this time.
So when we talk about the impact of trauma or adversity that is not recognized and addressed, there are real significant and long-term impacts that can happen. And that's why, early identification and early and coordinated response is so critically important. So when we think about what it means for us to put into place trauma-informed systems and practices, right? It's really about putting into place these healing systems and practices.
I'm honored now to introduce Bay Area Community Clinic doing just that.
My name is Norma Ledesma. Marin Community Clinic serves the low-income community of Marin. We have women's health, pediatrics, dental care, adult medicine, specialties. We also have health hubs where we provide food pantries for our patients. There is all kinds of different classes going on, nutrition classes for kids, for adults, psychotherapy, nutritionists. So it's a broad range of services offered. I'm a daughter of Mexican immigrants. My parents arrived to this country over 50 years ago, and I've heard their struggles. And working with the community these days, I hope I see my parents and every person I help, and I hope that any little thing I'm able to provide, or resource, or reference, or any kind of support will make a difference in their lives, because I always wish that, someone did that for my parents when they arrive here. All in for kids.
One of my friends calls this not only just self-care, but squad care. So for me during this time, I also rely on my friends and those who make me laugh. Those who know me, I love to laugh. So we have to find those tips that are really important for us to use for ourselves and figure out what's really personal. But if you need mental health support during this tough time, please reach out for help.
In doing this work with healthcare providers, as we've been, doing the trainings and helping to build capacity within our healthcare system, the number one thing I hear about is self-care. How do we do self-care for those who are healers, for those who are on the front lines, for those who are, trying to implement this work? And it turns out, in order for us to walk that talk, right? One of the most, it's essential in every sector. Whether you're an educator, or you're a judge, or to do that self-care, because it also tells us, I think it shows us that, there is a way through, that there actually, even if you're exposed to some really hard, difficult, dark, challenging things, that when we surround ourselves with people who really care for us and nurture us, and when we deeply care for and nurture ourselves, that there is a path forward.
Our time is up, but I want to share a huge thanks to All In for Kids sponsors and to all of you joining us today. Please help us spread the word by checking out allinforkidsca.org and look to see what else you can do to end childhood trauma, and register for our other summits this week for parents, educators, and more. So thanks again for joining, and be well.
Say